All right, safety pros, welcome back for another deep dive with us today.
I'm excited to be here.
We're going to be talking about something that is very relevant to all of you listening.
Yeah, absolutely. A big one.
Tuberculosis in the workplace.
Yes.
And specifically, OSHA's recording requirements for tuberculosis cases.
Absolutely. Very, very important.
So we're going to try to demystify 1904.11 for everyone. And we're also going to be looking at some interesting insights from Safety One Source.
Yeah, good stuff from Safety One Source.
So why is this such an important topic?
Well, I mean, this standard really, it lays out the specific criteria that OSHA uses to determine whether a tuberculosis case is work-related and therefore recordable on your OSHA 300 log.
Okay.
So, mastering this information is just crucial for, accurate record keeping and most importantly, protecting the health and safety of your employees.
Yeah. So we're going to break this down.
Yeah.
So you know exactly when you need to record something, when you don't need to record it and all that good stuff.
Exactly.
So let's talk about the trigger.
Okay.
So what exactly are we talking about?
So the trigger is occupational exposure. Okay.
Okay.
So that means that an employee developed a tuberculosis infection after being exposed to someone with active TB at work.
Okay, so after is the key word here.
Yes.
So we're not talking about someone comes to work and they already have TB.
Exactly. It's not pre-existing.
Right.
It's got to be after they have been exposed at work.
Okay.
And this is why it's so critical to have accurate workplace exposure records, because you need to be able to link a TB case back to that potential exposure at work to determine if it's truly work-related.
That makes sense.
Right.
So let's say that does happen. We have an employee who develops TB after a potential exposure.
Yes.
What are the criteria for OSHA to consider it a recordable case?
So there's two main criteria. The first one is a positive skin test or a diagnosis of TB by a licensed healthcare professional.
Okay.
It's really important to note here that a positive skin test alone is enough to trigger the recording requirement.
So OSHA is being very cautious here.
Absolutely. I mean, tuberculosis is serious. It's contagious.
Yeah.
And early detection is just so critical.
Right.
So OSHA wants to make sure that employers are staying ahead of, potential outbreaks and taking all the steps necessary to prevent further transmission.
That makes sense.
Yeah.
So, this kind of brings to mind a question that I know a lot of safety professionals have. And this is something that maybe when you're new to the field especially, might be something that you're kind of confused about.
Sure.
What about pre-employment physicals?
Right.
So you have someone who comes in, they take a pre-employment physical.
Yes.
They test positive for TB on the skin test.
Right.
Does that need to be recorded?
So that's a great question, and it does cause a lot of confusion. The simple answer is no. Positive TB skin tests from pre-employment physicals are not recordable.
Okay, I'm going to play the confused safety professional here.
All right.
Why is that?
Because remember, the crucial element is occupational exposure.
Okay.
So a positive test during a pre-employment physical means that exposure happened before the employee started working for you.
Oh, okay.
So it cannot be classified as work-related.
Okay, that makes sense.
Right.
So we've talked about the trigger. We've talked about, what constitutes a recordable case.
Right.
Now, what happens if you're an employer and you think that maybe something was recorded?
Right.
But you don't think it was actually related to the workplace?
Right.
Can you challenge that?
Absolutely. You can remove a recorded TB case from your OSHA log.
Okay.
However, there's a pretty high bar for doing so.
Okay.
You have to provide substantial evidence demonstrating that the infection was not work-related.
Okay, so what kind of evidence will we be talking about here?
So OSHA gives some specific examples. Say the employee lives with someone who has active TB.
Okay.
Or they were identified as a contact by the public health department for a case that's totally unrelated to their workplace.
Okay, so very clear cut.
Right.
Not related to the workplace.
Exactly.
Okay.
Or, a medical investigation that pinpoints the source of the infection to something other than work.
Okay.
So documentation is key.
Yeah, documentation is always key when it comes to safety.
Always. Always.
So it sounds like thorough record keeping is really important in these situations.
Oh, absolutely. You want to be very meticulous.
Yeah.
Documenting all your investigations, medical records, any evidence that supports a non-workplace exposure. This just ensures that you have, a solid foundation if you need to challenge a recorded TB case.
Okay, so we know that recording TB cases is important.
Yes.
But I think it's also really important to talk about preventing it in the first place.
Absolutely.
So beyond just knowing how to record a case, what are some things that safety professionals can do to try to minimize
that risk of transmission?
That's the million-dollar question.
Right.
You know, it goes way beyond just checking boxes on a form.
Yeah.
So, you know, you got to think about your workplace risk assessments. What are the jobs or tasks that might increase the risk of exposure to TB?
Right. So I'm thinking like healthcare settings.
Yes.
Correctional facilities.
Exactly.
Maybe homeless shelters.
Nailed it. Those are all high-risk environments.
Right.
So once you've identified those potential risks, then you can start to implement control measures.
Okay, so what are some examples of control measures?
So proper ventilation is essential to minimize airborne transmission. Respirators, especially N95s, can provide a really high level of protection for employees who are potentially exposed to individuals with active TB.
Yeah.
But don't forget, respiratory protection programs have their own set of OSHA requirements. So, you know, you got to make sure you do your homework on that.
Yeah.
And then, of course, training. Right. Employees need to understand the signs and symptoms of TB. Right.
How it's transmitted, the importance of reporting any, you know, potential exposures or concerns to their supervisor.
Right. So early detection is key.
Absolutely. The sooner you identify a case, the sooner you can take action to, you know,
stop the spread.
Stop the spread.
Yeah.
Yeah. So it sounds like, you know, there are multiple layers here.
Absolutely.
You know, we've got risk assessment control measures.
Yes.
Training.
Yep.
And then also screening programs.
Right.
So it's about being proactive and creating that culture.
Exactly. You're not just reacting after the fact, you're preventing it from happening in the first place.
And Safety OneSource and OSHA have tons of resources to help employers develop those programs.
Absolutely. They're not just about enforcement. They really want to help employers keep their workers safe.
Yeah. And so speaking of the specifics of recording a TB case, let's talk about the OSHA 300 log.
Right.
What are some of the essential details that we need to make sure we're capturing?
Okay, well, first and foremost, make sure you're using the correct form.
The OSHA 300 log is specifically designed for work-related injuries and illnesses.
And this definitely falls under that umbrella.
Exactly.
If it meets those criteria we talked about earlier.
Absolutely. So when you're completing the log, you need to provide some key pieces of information about the case. You know, employees name their job title, the date of the positive TB test or diagnosis.
Okay. We check that box that it's a respiratory condition.
Exactly. And describe the circumstances surrounding the case as clearly as possible.
Okay.
How was the employee exposed? What were their job duties at the time? You know, this just helps, you know, paint a clear picture of the situation and the potential risks.
So once again, detailed documentation is really important.
Absolutely. And remember, this log isn't just for OSHA.
Okay.
It's also a valuable tool for you as an employer to track trends, identify patterns, and, you know, continuously improve your workplace safety practices.
Okay. So we've talked about the specifics of OSHA.
Yeah.
We've talked about the broader picture of TB prevention.
Right.
Any final thoughts, key takeaways you want to leave people with?
I think the biggest takeaway is that TB prevention is not just about compliance.
Yeah.
It's about, you know, protecting the health and well-being of your workforce.
Absolutely.
You know, by understanding the risks, implementing effective control measures, and fostering that culture of safety, we can really make, you know, significant strides in preventing the spread of this disease.
That's a great point. And if anybody's listening and feeling a little overwhelmed by all of this information, you know there's a lot to know.
Right.
Remember, you don't have to go it alone.
Absolutely.
You know, organizations like Safety OneSource,
they're there for you.
Have a wealth of resources to help you navigate all of this.
Yes.
So don't hesitate to reach out if you need help.
Right. Reach out to Safety OneSource.
All right. So we're going to take a quick break.
Okay.
And we'll be back in just a minute to continue our deep dive.
Sounds great. Yeah, it really is. And, you know, taking that proactive approach, it not only protects your employees' health, but it also helps you avoid those potential OSHA citations and penalties down the line.
Yeah, nobody wants that.
Nobody wants that.
So you mentioned that Safety OneSource offers some resources for, you know, developing a TB prevention program.
Yes.
Can you tell us a little bit more about what those resources might include?
Absolutely. They've got a ton of information on their website.
Okay.
You know, articles, webinars, even downloadable templates for things like risk assessments and exposure control plans.
Oh, wow.
And they also have a team of safety consultants who can, provide that personalized guidance
Okay.
based on your specific workplace and industry.
So they really try to tailor it to your needs.
Absolutely.
That's really helpful.
Yeah, it's like having a, safety expert on call whenever you need one.
Right.
Yeah.
I know our listeners appreciate that.
I hope so.
So we've talked a lot about, the why and the how of TB prevention, but I think it's also important to touch on the, legal and ethical considerations.
Yes, definitely some sensitive areas there.
Right.
Especially when it comes to employee privacy and confidentiality. You need to handle medical information related to TB with the utmost care.
Right.
And comply with HIPAA regulations.
Absolutely. And what about discrimination?
Yes.
Employers need to be very careful about not discriminating against employees with TB or who've been exposed to it.
Absolutely. The Americans with Disabilities Act, the ADA,
right,
protects individuals with TB from discrimination in the workplace.
Okay.
Employers need to make reasonable accommodations, for employees with TB.
Okay.
Such as providing, modified work duties or flexible schedules, as long as it doesn't create an undue hardship for the employer.
So it's all about finding that balance.
It is.
Between, protecting everyone and also respecting those individual rights.
Exactly.
Sounds complicated.
It can be.
Yeah.
That's why it's so essential to consult with, legal counsel and safety professionals who are well-versed in these matters.
To make sure you're dotting your I's and crossing your T's.
Exactly.
So let's shift gears a little bit and talk about the role of technology in TB prevention.
Okay.
Are there any new or emerging technologies that are kind of making a difference in this area?
That's an interesting question. Technology is constantly evolving.
Yeah.
And there are definitely some exciting advancements that are impacting TB prevention and control. So, for instance, we're seeing, more sophisticated diagnostic tools that can detect TB infections, faster and more accurately.
Wow, that's great.
Yeah.
What about contact tracing apps?
Oh, yeah.
I know those have become
in recent years
very popular with tracking different kinds of diseases.
Absolutely. They played a significant role in managing other outbreaks like COVID-19.
Right.
And they certainly have the potential to be helpful with TB as well. These apps can help identify individuals who may have been exposed to someone with TB and alert them to, get tested and seek treatment if needed.
That's great. So it can help kind of get ahead of it.
Absolutely. Early intervention is key.
Are there any challenges or limitations with using technology like that?
Well, there are always challenges with new technology.
Right.
One concern with contact tracing apps, for example, is privacy.
Oh, yeah.
We've got to make sure that these apps are designed and implemented in a way that protects user data and respects privacy rights.
Right. It's a very fine line.
It is.
So thinking back to our conversation about OSHA record keeping, are there any specific resources or tools that employers can use to kind of help them stay organized and compliant with their reporting obligations?
Definitely. There are several software programs and online platforms that are designed specifically for OSHA record keeping.
Okay.
And these tools can automate a lot of the tasks involved in recording and reporting workplace injuries and illnesses.
So it takes some of the burden off of the safety professional.
It does, and it can also help reduce errors and ensure consistency in reporting. Yeah. A lot of these software programs also offer features like reminders and alerts.
Oh, that's nice.
To help you stay on top of deadlines and reporting requirements.
Very helpful.
Yeah.
Especially for busy safety professionals.
Absolutely.
So speaking of staying on top of things.
Yeah.
Let's talk about best practices for, ongoing TB prevention.
Right.
It's not a one and done deal, right?
Absolutely not. It requires continuous effort.
Okay.
It's essential to regularly review and update your risk assessments, your control measures, your training programs, just to make sure they're still effective and relevant to your workplace.
What about staying informed about, the latest developments in TB research and treatment?
That's crucial. The field of TB research is constantly evolving.
Right.
New diagnostic tools, treatment options, prevention strategies, they're emerging all the time. So staying up to date on those advancements is really going to help you make informed decisions about your TB prevention program.
So how can safety professionals stay in the loop?
Well,
and make sure they have the latest info?
There are several great resources out there. Professional organizations like the American Industrial Hygiene Association or AIHA.
Okay.
They offer continuing education courses and webinars on TB and other occupational health topics.
Great.
The Centers for Disease Control and Prevention, the CDC,
Yeah.
They have a wealth of information on their website, including the latest research findings, guidelines, recommendations for TB prevention and control.
It seems like there are a lot of resources out there.
There are.
For safety professionals.
Absolutely. And don't forget, Safety One Source is another excellent resource for information and guidance on TB and other workplace safety issues.
They're a great resource.
Yeah, they really are. They've got a team of knowledgeable consultants who are always happy to answer your questions and provide support.
So I think we've covered just about everything there is to know about TB in the workplace.
I think so.
Any final thoughts or takeaways you'd like to leave our listeners with?
I'd just like to emphasize the importance of taking a holistic approach to TB prevention.
Okay.
You know, it's not just about following OSHA regulations or implementing a few control measures.
Yeah.
It's about creating a workplace culture that prioritizes health and safety.
Right.
And empowers employees to take an active role in protecting themselves and their colleagues.
Yeah, I love that.
Yeah.
Yeah, it really is about, creating that environment where people feel like they can speak up.
Exactly.
If they have a concern and, everybody's working together towards that common goal.
Yeah, when employees feel valued and supported, they're much more likely to, engage in those safe practices.
Right.
Report potential hazards,
And that's so important for early detection and prevention.
Absolutely.
Yeah, so it sounds like, effective TB prevention.
Yeah. It's a multifaceted approach. You've got the regulatory compliance, you've got those practical control measures,
right,
and then you've got that strong safety culture.
And it all works together.
It all has to work together, yeah.
Yeah, that's a great point to end on, I think.
Good stuff.
We covered a lot of ground today.
We did?
From, those OSHA requirements to the bigger picture of prevention.
Absolutely.
And hopefully our listeners are feeling a lot more informed and equipped.
I hope so.
To tackle this.
Yeah, it's a big one.
Important topic.
It's important.
And I just want to remind everybody, you don't have to navigate this alone.
Right.
There are resources out there like Safety One Source.
Absolutely.
Who can provide that guidance.
They're there to help you.
And support.
Every step of the way.
Don't hesitate to reach out.
Right. If you've got questions, you need help, reach out.
All right. So
they're there for you.
That wraps up our deep dive for today.
Great deep dive.
On tuberculosis in the workplace.
Yeah, thanks for having me.
We hope you enjoyed it, and we'll see you next time for another deep dive.
Sounds good.